chat with y'all really quickly about blueprints for exams. Let me at my screen. Okay, so hopefully y'all can see my screen, and I wanted to pull it up from the website itself so that you're able to see what I'm talking about. I get questions all the time. Every year, I always get these questions. And hey, the reason I can tell you is because I did the same thing. Y'all know my story. I didn't pass on my first attempt either. And I had to find the ways to really understand what the test was testing on, see where I was missing marks or what I wasn't missing and where I needed to probably give more time to, what have you. And I went through everything possible. So when I tell y'all to look at the blueprint, the AANP provides one, ANCC provides one, and they're broken down by the certification exam. So FNP, AGNP, etc. So here I'm doing the one on ANCC. I will do another one on the AANP. This is for the FNP exam, but I just wanted to kind of give you an idea. So commonly I get the questions, do you think there's going to be a new exam out? I always stay on top of that. I'll let y'all know when I know. But also I tell you guys, follow it. They tell you what you need to know, okay? So if you look here, you see it's from ANCC. And all you have to do, Google it, y'all. Just type in ANCC FNP blueprint or AGNP blueprint, whatever you're looking for. AANP, same thing, you'll see it. But you see, it shows you the outline. The last time this was done was September 28th, 2022. They typically change the exam every 3 to 5 years. The last one was 2019. So we're getting close to a time that it should be getting changed. But as you can see, they just updated this outline in 2022. So let's just stick with this because this is what is most current, okay? So it'll give you the whole breakdown, letting you know that there are 175 questions on the exam of these, and you know that's decreased from previously, but 175 questions on the exam. You know 25 of those are just those questions that they kind of test to see what they want to do and see what they can use for upcoming exams. And then 150 of those questions are scored, right? So that's all it's telling you in that first paragraph. And the next thing, you'll see the breakdown. So you know I always teach you guys to study in assessment, diagnosis, evaluation, treatment, right? And I tell you in that scenario because I tell y'all that's what they're trying to figure out. They want to make sure you know that in all the conditions that are most commonly seen in practice on both boards. Now, the AANP specifically kind of breaks it down into those 4 components. The ANCC breaks it down in one additional where they have theirs, as you can see, assessment, diagnosis, implementation, planning, and evaluation. And then as I go through it, you'll see what I'm talking about, but I kind of group the planning and implementation together in that more so treatment phase. But stick with me. That's why I break my review courses and my review books down in this fashion, because this is what you need to highlight when you are looking at content for boards, okay? So I'm gonna zoom in a little bit so y'all can see a little bit better. But as you can see, it's telling you specifically the breakdown. Assessment, there will be 29 questions, 19% of your exam. Diagnosis, 26 questions. Planning, 29 questions. Implementation is huge. 43 of your questions on the exam, and then evaluation 23 questions. Then it breaks it down by body systems that you can see, the drug agents and the age groups. They give you the breakdown, letting you know the ones that have asterisks beside it are the ones that are less emphasized on the exam. But here, because you're thinking, all right, Brittany, what do they mean by assessment? What do they mean about diagnosis, planning, implementation, and then evaluation? You'll see down there. But you know, I talked to you about it. If you haven't, go look at some of my other videos where I break down scenarios so you can kind of think of it in that fashion. But here, they're letting you know what they're looking for. So under assessment, you know, these are evidence-based health promotion and screening type things that we're doing when you're assessing people. This is evidence-based that we have found this. But what they're truly checking to know is your skill set on when they give you a scenario. It's going to be a history and physical. You know, what would you put under that assessment area? They'll give you a scenario that basically sounds like the H&P portion, right? And it's going to have all of those areas trying to see if you're able to see the cognitive, developmental, physical capacity, family and caregiver roles, all of this stuff. It's just basically telling you, hey, know how to assess. What are the signs and symptoms? How do they present in all of these aspects, right? Diagnosis. What is a diagnosis? Talk about clinical manifestations. Okay, look, how does this manifest for you with these signs and symptoms that presented in the assessment to lead you to a diagnosis? What diagnostic exams do you do? What are the gold standard diagnostics? What are we doing to diagnose this? What are your differential diagnoses in any of the fashions or scenarios that they provide for you? And you'll see that they have those listed: diagnostic test selections, differentiating between normal and abnormal physiologic changes, labs, things like that, and formulating differential diagnosis. If y'all don't believe me, go back to my videos. Y'all know this is what I tell you. Trust me. Study in this breakdown. You will do well. Planning, it gives you a generalized scenario. You'll see here that it basically sounds a lot where you see like the primary, secondary, tertiary, prevention, you know, all these things. End of life care, cultural, sensitive practices, things of that nature. This is where the non-clinical aspect is very heavy on ANCC. I always get the question, is it on AANP? Yes, but it is heavy on the ANCC. Make sure you're studying your non-clinical content. But they're talking about this in the planning and implementation, legal and ethical implementations you see under here. But what they're really trying to see, if you think about when you're doing, think of a SOAP note. When you get to the plan, how do you plan to treat this person? What are you planning to implement based on your assessment and diagnosis on this patient, right? So that's all planning and implementation is. Y'all know what planning and implementing means. Don't let the breakdown or how they may word this scare you or make you become confused. You know what it means. So just apply that to the actual condition. Each one study in that fashion. Let's see. Implementation, again, it talks about legal and ethical implementations, pharmacologic intervention and treatments, procedures, treatments, things I told you. The medicines, guidelines, what are the treatments, y'all? And then evaluation, going back, look, test results, evaluation management and reporting. How do you evaluate those things you found, right? So let me just break it down. One of the classic ones I like to kind of say to y'all is think about pneumonia. And so I can kind of put it in this full picture for you. Pneumonia, you thinking when you're doing the assessment, how do they present? Do they have a fever? Do they have rust color sputum? Did the symptoms become gradual symptoms, or was it a rapid onset? How did it, occur? Listen to what the patient is telling you and look at your patient. How are they presenting to you? Signs and symptoms, assessment, right? You're doing your vitals. Do they have a fever? We talked about, or are they afebrile? Assessment, right? Next, diagnosis. What is the diagnostic exams? What are you doing? Also, when you're assessing, are you asking, have they been on antibiotics recently? Again, back to diagnosis. What is the gold standard? Chest x-ray, right? Where you see those white patchy infiltrates, right? That's the gold standard diagnostic exam. Isn't that how we get that diagnosis? Right? So then we're thinking about the planning, the implementation. How do you plan on treating? We're starting to think again, back to the assessment. Have they been on antibiotics before? How severe are their symptoms? Going through the gold standards. What are their age? Are they either older than 65 years of age or not? What is their blood pressure? Just thinking and going through all of those steps that we know to do to get to that plan. And then evaluation. Is following back up with the patients and evaluating based upon their signs and symptoms, how they responding to the antibiotic. How do they respond to that antibiotic? Do they need a change in antibiotic, etc.? Okay, so go look up the blueprint and break your studying down again. Assessment, diagnosis, evaluation, and treatment. And look for my next video where I break down and show you how the AANP says it the same way. Okay? Bye, you guys.